Thank you for the kind introduction and thank you for staying so late in the afternoon. I'm honored to have this occasion to share some of my experience on family caregiving with you. I work in IMH and I do quite a bit of family counseling and working with families to help them to cope and understand their loved ones who have mental illness. All right. So I have about 20 minutes with you. So okay, let me. Okay, all right. Before I begin, I want to say that what I'm going to share with you really comes a lot from the people that I work with, the patients that I work with, and the families, and all the very intimate stories that they tell me. And of course, myself, I'm a caregiver to my mom who has Alzheimer's. She's wheelchair bound, and I also want to thank her for giving me a chance to love her and to care for her. Like the experience of Prof here and Patsy is really a joy caring for people who need us. Yeah. Okay. Quickly, this 20 minutes, I'm going to share with you the challenges and the effects of the burden of caregiving. Challenges, but there are also beautiful things that we get out of caregiving. All right. And I also very quickly share with you the range of caregiving services in IMH and for caregivers of mentally ill patients. Okay, let's look at challenges first, yeah? Okay, the stigma of mental illness, we all know. I'm sure you have seen Channel 8 dramas where they depict supposedly crazy men running around the village and killing people, and our media love to exaggerate stories about, one or two persons who have mental illness, and they do things that are they are perhaps violent, but there are a whole range of another big population of mentally ill people who are doing very well in the community. So I think the stigma of patients is a big thing, but the stigma of being a caregiver and a loved one to someone with mentally ill is also very much there. So when we work with caregivers of people with mental illness, I think talking with them about this issue of stigma is really a big thing, because it's not just the patient who gets judged. Sometimes families also feel like they're being judged. What's wrong with this family? How come there's someone who's not well, who's mentally ill in the family? So I think being able to attend to some of these stigmatized beliefs is very important. Okay, we know Catherine Zeta-Jones. She had OCD. She's someone who, she's the partner in Zorro. Brooke Shields, that pretty young teenager in Blue Lagoon, she has depression. Winston Churchill had diagnosed with depression. Abraham Lincoln never diagnosed, but they suspected that he had depression. But all these people are doing well in their lives. Okay, so I also want to say a lot of great things about people who have mental illness and who are doing very well. And there's not a lot of stories about people who are doing well, but a lot of stories about people who kill others and who hit others and hurt others. All right? Okay, it's important that we understand how difficult it is for family caregivers to work and to live with a person with mental illness, because some of the symptoms can be very hard to understand, So sometimes they can get so low, so down. For some reasons, they seem so hypersensitive over very little things that the family members may say. Family members sometimes feel like they're walking on eggshells, not knowing how to manage. So everybody's really trying to make sense of what their illness is. So it's really very important for family caregivers to understand what the illness is and what are the symptoms and what to look out for and how to manage some of these difficult behavioral issues that can come up, when they are relating with family members. Okay, and children, I also want to emphasize how children who comes from families with adults or parents with mental illness, how they often experience, how come mommy just didn't come home for 2 months? How come mommy cut her wrists, and then there's so much blood? How come daddy shouts at mommy and he looks so fierce? So children also need to make sense of what the family members go through. And children are sometimes even expected to be caregivers. I'm sure you come across young children, maybe even in their teens, who sometimes don't go to school. I come across this 11-year-old boy who doesn't come to work we didn't go to school. His uncle came to the family center that I used to work with and says that, you know, my nephew is not going to school, he's staying at home. So I did a home visit, and there mom was having a relapse of schizophrenia, and this 11-year-old boy stayed at home with mom because he wanted to look after mom. This is what we call parentified children, you know, and these are young caregivers who really shouldn't be caregivers. But we need to look out for the children of people with mental care, with mentally ill, so that we can also offer support and help to them. All right, and I think it's important as caregivers, we need to be able to talk to the doctors, the nurses who care for our loved ones, and to understand what the illness is all about and try to make sense of what's happening. All right, and looking after someone with mentally ill can be very challenging. You know, when you have a depressed person, sometimes they really want to sleep the whole day and they don't even want to wake up, and you really have to coax them up, come, wash your face, go to get yourself clean up and stuff like that. So the work can be really, really difficult. And then looking after a child with special needs, with cognitive disabilities, and especially when the child has grown up and is quite big and you still have to do a lot of basic things for them, cleaning them, it can be very, very challenging for parents, all right? Okay. And very often when family members and caregivers don't know how to cope with the emotional upheaval that the patients go through, or do not know how to, cannot understand what's going on, what they do is they just distance themselves away, all right? So having mental illness can sometimes increase that distance between the person with the illness and the family and the loved ones, or even friends. You notice that a lot of our patients with mental illness, they start to feel very isolated because everyone leaves them, because the people around them don't understand what they're going through, all right? So really, it's important that, you know, our family members learn to understand the illness and learn how to make connections with them. Okay. Okay, this idea of ambiguous loss comes from this scholar called Catherine Bors. Let me give you an example of ambiguous loss. I was doing a research on family caregiving, and I was talking to this lady whose husband has Alzheimer's disease. I was doing a home visit, and she was feeding her husband. He used to be a very high-powered person who worked in some big companies, and he was the head of the household and stuff like that. And when he had Alzheimer's, he was being looked after by a helper, and she was also staying at home to look after him. They were in their 60s, and he can't talk anymore, but he get very agitated, and then he would make noise, and he needs to be fed through a tube. And as I was interviewing this lady who was sharing with me about the trials and the challenges of caregiving, she said, "My husband is no more the husband I know. Although every day I'm with him, he's not the person that I know. He used to be so loving. He used to care for us. But now he's always having temper tantrums. Sometimes I don't know how to deal with him. I feel that although I see him every day, I have lost him." So this sense of ambiguous loss is like you are with that person physically, but the essence of that person, the soul of the person is no more there. It's almost a totally different person. Even with a lot of patients who had schizophrenia, we have a lot of patients before they had schizophrenia, before they had psychosis, all right? They were very different. But once they had that illness, you know, and if they keep going on having relapses and they are not taking medication, they're not compliant to medication, you can have a total personality change. And family members can actually experience that person to be very, very different. And they have what they experience is this sense of loss called ambiguous loss. The person is there, but the soul is not there, the essence is not there, the relationship is no more there. And this kind of loss and this kind of grief is very, very painful because he's there, but he's not quite there, all right? Okay, all right. So coping with ongoing sadness for family caregivers is something that we need to recognize, okay? And this intense sadness grips us because someone whose life is challenging, whose vigor has been taken away, or whose mental functioning has deteriorated. This grief does not go away, especially when we're talking about someone with chronic mental illness, all right? And from time to time, it brings fresh new tears and new fears. We need to acknowledge this sadness. So for a lot of family caregivers, this grief is ongoing, okay? It is about not taking away this grief. It is about learning to live with this sadness, learning to live with this sadness and at the same time moving on with their own lives. Okay. So caregiving has its loneliness, however unintentional. Okay, if you're the main caregiver, even you have a lot of support systems, at the end of the day, it is still a very lonely experience. Okay. Okay. One interesting challenge about family caregiving is a lot of complex family dynamics can actually get stirred up in the process of caregiving. I give you an example. I have this couple, they are in their 40s. Their relationship is one of distant husband and wife, just stay on in a family, just to keep the family going. And they don't have very much of a couple relationship, all right? So this woman spends a lot of attention, gives a lot of attention to bringing up her only son, all right? So her sense of identity is, I'm the mother to this boy. One day this boy had schizophrenia, and you know, he is quite a different person from what he used to be. He used to be a doting son and what have you. So after he had mental illness, there was a shift in his personality and his response to her. The relationship was quite different. He was demanding of her, unlike what she used to be. So what happens is that when the son has illness, this marital relationship has never quite been there, but it becomes even difficult for the mother to cope because she didn't have quite very much of a marital relationship. But now even her relationship with son she's struggling with that. So that illness and that role as being a caregiver actually stirs up this marital problem, and the marital problem becomes more intense and more hard to cope because now she finds herself very much alone in the family. So that's what I mean by when someone has mental illness, when the main caregiver have to take on caregiving roles, and if there are existing family difficulties, the existing family difficulties becomes exaggerated, comes to the surface, and becomes a bigger trigger for the family caregiver. All right? Okay. And this mother is saying, how come when our son gets ill, I'm the one who has to do everything? Okay. So all these unhappiness would actually come out in the caregiving experience. Okay? And this is a caregiver whom I just want to quote. He said this: "You will think that in situations like this, the family would come together, but they don't necessarily. And in my case, they didn't. So we had a lot of issues to deal with. If you can resolve the issues, make it better in dealing with everything that's coming your way, it would be really good." All right? Okay? Okay, so sometimes, you know, when you think that help will be coming, they will not be coming. But also sometimes caregivers do not want to ask for help. They want to believe that I can manage this on my own. And what happens is that they isolate themselves, and then they feel very, very alone in the experience. And most of them, when they feel very alone in the experience, is when they shut off and cut out the other people and not ask for help. Okay. Okay. Managing role reversals. Okay, our parents brought us up. Okay, they know that as parents they need to take care of us when we're young and stuff like that. But when they become old and when they have Alzheimer's and dementia, and when we have to care for them, at the early stage of their illness, they can really struggle with us because it is hard for them to see us caring for them. It is hard for them to see us doing things for them, cleaning their backsides, changing for them, bathing for them. And sometimes they resist. Like for example, it took my mom 2 years to agree for me to buy a wheelchair for her, all right? And finally, when I had to wash her backside, and she said, I thought I never need to have you guys see my body naked. I thought that the day you see me naked will be the day I leave the world. I didn't expect that this could happen. So it was very sad for her that her children have to do this back to her. So sometimes they also go through a lot of grief, you know, because it's so hard for them to experience that role reversal. Okay? And this couple that I just saw last week, they're in their 40s. The son has obsessive-compulsive disorder. He's not very compliant with his medication, so he had 2 relapses, and he's not quite able to go to work, so he stays at home, and we're trying to rehabilitate him, okay? But he's 25, okay? He might have OCD, but he still believes that I'm 25 and I have a right to have my own life. Why is my mom controlling me, telling me that I shouldn't mix with this guy, I shouldn't leave my home? So the 25-year-old mentally ill patient also wants to have his own life. He knows that he also needs to have space to grow up. But the parent is very hard and ambivalent for parents, because as much as I know that you're 25, but you're not able to manage your life at this point of time. So parents and adult children who have mental illness often struggle with how to manage that space. All right, so that's and managing that space often lead to a lot of conflicts between them. Okay, so that can really be, and you see a lot of shouting matches, temper tantrums, and sometimes even mutual violence. All right, as in, like, in this case, the dad actually was so angry he gave the son a big tight slap. All right, and the son was so angry after dad slapped him, and he turned the table over, and the police were caught in. Okay, so this is what happened, right? So in the event of someone of a mentally ill patient seemingly exhibiting a violent behavior, we also need to understand the context. That person could be reacting to a certain upsetting behavior. All right, so we need to be very careful not to think that when someone does that, it's because he's ill, that's why he's crazy, that's why he does that. All right, so we need to understand the dynamics then about what happens in the family. All right, and challenges of being a caregiver, you have to really understand, you know, all that, the step-down care, all the services available, you know, meeting up with the doctors to find out what's going on, okay, attending counseling and psychoeducation sessions that we run in the hospital, all right? And also, we sometimes also like to encourage our loved ones to try and do some vocational help, bringing them for interviews and facilitating all that kind of activities. Okay, and some forms of mental illness do debilitate some of our patients, and we may need to look at long-term care. And parents of adults who have chronic mental illness, they really have to look at what they need to put in place in the event that they pass away. So they have to consider what does the law says about, you know, they perhaps have to go to the office of the public, you know, a guardian, to see what are some provisions that they can provide for their son. So they have to go find out, go and make applications and stuff like that, all right? And it's a lot of work, and it's a lot of research and finding out what they need to do, okay? So these are all the challenges, and if we are able to advise them where to go, how to go, it makes the job a lot easier, okay? And if you're caring for your elderly parents who have dementia or Alzheimer's, you know, sometimes if you have many siblings, and then you have to probably say, hey, you know, we need to look at how much mom has, need to sort out her bank account, make sure that if anything happens to her, you know. So sometimes if you're the main caregiver and you have to start talking about money like that, it can be quite sensitive if you have many sisters and brothers, you know. And but you have to handle them, because if you don't handle them and the elderly person passes away, the money can get really quite stuck, you know, in some areas, and it can be quite difficult to get them out, all right? So, but then these are things that you need to handle, you know, you need to handle, and how caregivers, as professional caregivers, we can advise them about what they can do, where to go, okay? This independence trap is something that Patsy talks about, how, you know, we always believe that we can handle things and we don't need other people to help us, really, okay? Being independent as a caregiver doesn't mean that you don't need other people in your life. It means knowing your ability to deal with adversity, as well as expressing feelings, asking for help when appropriate, sharing your needs. I think personally, as a caregiver myself, when I first started, I used to say that I would do this myself, I don't want to trouble my sisters and brothers. But after a while, I realized I can't do this. If you want to go on independently, I'm not gonna make it for so long. So I think this independence trap is something that you want to look out for within yourself, and if you're a caregiver, look out for that with the person that you care for, and, you know, reflect that what you're experiencing about that person to him or her. Caregiver's guilt is another big thing, all right? Okay, it is one of the major hurdles that hinder most family caregiving. When caregivers have expectations like, I should do this, I shouldn't go for a holiday, I should stay with my mom, I should, you know, okay, I saw this Indian lady yesterday, and her husband hit her. And she said, I should not hit him back. I should not. He had hit her many times. I should not get a PPO. I should keep the family in a harmonious fashion. If I do anything against my husband, things are not going to work out. So there's a lot of, I should bear this. I should, it's my responsibility to keep the family together. I'm not important. What's important is my children. So they set a lot of I shoulds, and it really traps them in a very, very difficult situation. Okay, but we want to acknowledge that these emotions are real. Okay, but we should not let them paralyze themselves and not do anything to protect themselves and for them to care for themselves. All right. So Patsy was talking about the need to balance our dreams, our career, and what we want to do in our lives, as much as we want to care for the loved ones, our mentally ill loved ones. Okay, continue to take care of your social relationships, go and have your coffee out with your friends, get someone else to, care for the loved ones in the meantime. So we need to do that, all right? Okay, for male caregivers, the hardest part about asking for help was shredding the cultural condition that men are tough and that men don't cry. Male caregivers also suffer, they also cry, all right? That real men should be able to handle whatever life throws them away. I'm sure there are a lot of male caregivers amongst us. And I think male caregivers, especially if they are looking after their loved ones, we do see some men looking after their mothers. I remember I was working in an elder protection center once, and we had this man in his 50s, and he was looking after his mom. Okay, and what he did was he actually had to bathe mom, clean mom. And there were some people who were sniggering and saying, what is this man looking after his mother? He cleans her. Is he sexually abusing her? So this is what happens, when male caregivers try to look after their mothers, we have people who are thinking like, is it appropriate for a man to look after the elderly mother? And they could be judged negatively. So I think male caregivers are really in a more challenging situation, and we need to be able to empathize them and to support them, and to allow them to cry, allow them to grieve as well. Okay? Compassion fatigue, I think Patsy talks about this, about how over a long term, if we do not take care of ourselves, this is what happens to us. Okay? And depression has been found to be one of the very common outcome of caregivers or mentally ill patients. As I work with my mentally ill population, a lot of the caregivers do have some amount, maybe they are not in depression, but they do exhibit some depressive traits sometimes, all right? So I think we need to look out for this and then to even get help for them. In IMH, we do quite a bit of caregivers counseling, doing family therapy for caregivers and helping them to work through their grief, to work through their pain, and to get family members to support them and to share responsibilities. Okay? And like I said just now, caregiving sometimes can turn to rage, turn to violence. Okay, this can happen in our population of mentally ill patients. Sometimes caregivers are so frustrated they don't understand what's going on in our mentally ill patients, and they will just strike them to say, "Will you just get out of that depression? Can you please snap out of the depression? This is not mental illness, no. You're just putting on, So a lot of people don't understand, and they think that some patients just choose to become mentally ill, and they could just lap out of that mental illness, and they think that one slap across the face, can take away the illness. So sometimes it can lead to abuse at home, and even among the elder population, violence towards elderly patients is also quite common in Singapore. I worked with elderly patients who have been abused, and many of them have dementia, and they are not able to protect themselves. They're not able even to call for help. So we also want to look out for this group of people who get abused and do not know how to call for help. But I must also say that for many of these caregivers who strike and who turn violent, they didn't choose to go that way. I think most of them were acting out of desperation. They didn't know how to get help, and it is then our job to look out for them and to support them. All right. I must say that the majority of them didn't want to go that way. All right. Okay. So respite is not a luxury; it is a vital necessity. All right. Okay. Okay. It's really necessary for us to go for a break once in a while. Okay. Okay, and education and support services are very important. I'll share with you what are some of the services that we have in IMH. Okay, we do run family psychoeducation workshops. It is a full day kind of workshop where we invite a psychiatrist to share with the group of people. Usually we invite up to about 25 persons. The psychiatrist will share with the caregivers what depression is or what schizophrenia is. We usually tailor it to a certain illness group. And then we have a social worker who would also address the audience to tell them how to make connections with the patients, how to communicate with them in such a way where they could gain better understanding. We also group the audience into small groups and we get them to share about the struggles, you know. And very often in these groups we see a lot of people really breaking down because for many of them it's the first time that they could share their pain and in a group like this, and they feel very supported. Oh, I'm not the only one who goes through that. Okay, so we within a day we break these two groups of people into two, and for the second group work we get them to look at what their strengths are, what has been working, so that they can go back feeling more energized. All right, so that's what we do. We try to do this. And when we run a dementia psychoeducational group, we get the occupational therapist to join us, and she will also share with caregivers how to manage these patients. Okay, so these are some examples of what we do in a group together. And if you have any friends or relatives who might benefit from this, just give us a call and we would be able to link you to the next group that we are doing. All right? Okay, so these are the group that we do, learning together in groups. All right? Okay, unlocking the silence. Okay, and what are the community resources? I think it's very important to equip family members with resources, because if they know what resources are, they don't feel so isolated and alone. Okay, and we also do individualized family psychoeducation workshop. If a family wants to meet a social worker, we sit down and we go through topics like stress and management, family communication, how to manage conflicts, how to understand and connect with their loved ones, how to talk to children about the parents' mental illness. This is something which I think is very, very important, all right? Because children of parents with mental illness, okay, they are more vulnerable to mental illness themselves. Studies have shown that, you know, life skills workshop and strengthening them can be very helpful for them. And also managing family violence, okay? So these are some things that we do in the IMH, and we also do family support and we do family therapy, okay? And we also organize outings for families, because it is very seldom that some of our families actually bring out their loved ones out, okay? So we have brought them out for kite flying, for prawning, and events like that, and we encourage the families to come together with their loved ones, okay? And this is also a program that we do. We do a 2-day life skills program for children of people or parents with mental illness. And during these 2 days, we will work with the children, go through their stress, teach them what is stress, teach them what is mental illness, teach them, get them to talk to us about what are the struggles. And in some of these groups, there was this child who actually told a group facilitator, you know, when my parents quarrel, I actually thought of bring my little brother, and we wanted to run away from home. And it is doing groups like this, when we work with the children, we hear very painful stories from children, right? And within this workshop, we also invite the parents to come together, and we get them to talk about what are the struggles as parents, having mental illness and parenting their children, okay? And then we also share with them about how they could, what are some tips that they could learn to share with their children what mental illness is, okay? So we also have family games together. We end up with a family lunch, a family party, basically hoping to help to bond these families together, okay? We're hoping to be able to do follow-up for these cases as well, all right? And in December, we're actually running a 2-day camp outdoor camp for another group of children. So if any one of you who know of children or parents with mental illness who are aged between 8 years to 12 years, please give a call to us, IMH, and we would be happy to register many more children. All right? Okay. All right. Okay. So caregiving has the potential to alter us at the core of our being, opening our heart's capacity to live fully, even in the midst of loss. All right. So caregiving is tough, it's challenging, but it actually opens up, and it actually helps us to understand, like Prof said, understand life better, to understand ourselves better, and what we can get out of caregiving can be more than what we think that we give. All right. All right. And this beautiful quote. I used to say that the purpose in life was to make a difference in the world. All right? But I guess that I can make a difference in one person's life. It took a long time to get to that understanding. It is right in front of your nose. You don't have to go out there looking. A family caregiver. Okay. There's one day I was rushing out. At 5:30, I have to rush home to take over the shift to take care of my mom. Then my Hokkien colleague say, "Hey, where are you going?" I said, "I'm going home to wash my mother's backside." And she said, go, you will go to heaven to have this blessing to wash your mother's backside. So every time when I wash my mother's backside, I say, "Oh wow, I'm going to heaven," and it feels great. It feels great to know that, It's a lovely thing that she always reminds me. Yeah, I think what you take back really is more than what you give. Yeah, okay. And I'd like to thank you.